to the class. Welcome, everyone. Thank you for joining Vital Connections Community Convo today. My name is Rosie DeCanto. I'm the Community Engagement Specialist at Vital Connections. And in honor of Heart Health Month, today's topic is on Heart Health 101, prevention and early screening. We'll be joined by two cardiologists from Live Better Trial who will share insight from current research on heart disease prevention, early detection, and health outcomes, and how evidence is shape and improve screenings and treatment approaches. We also have Bouba. He's the founder of Heart of a Giant, who he will also be sharing his personal heart health journey. And we also have Brian. He's a participant in the Live Better heart health research study. And he will also be sharing his experience as a patient in that trial. So before we move forward, I just want to read over the participants agreement so that way we're all on the same page and you know what to expect. Let's go to the next slide. So these are the participant agreements we'll be reviewing. And here, I'll just read them off. Usually I have the audience read off, but since we are running a little bit late, I can just read them off. Listen with care. Hold space for each other by practicing active and compassionate listening. Whether you're a panelist or a community member, step up, step back. Share your voice if you haven't spoken, and make space for others if you've spoken a lot. Speak from the I. Share your personal experience instead of generalizing for others. Honor all forms of expertise. Professional training, research, and lived experience all contribute valuable knowledge. Create space for different voices and ways of knowing. Respect confidentiality. Personal stories shared in the space stay here, unless you have permission to share outside. Panelists are here to share knowledge and lived experience, not medical advice. Please consult a licensed healthcare provider for personal medical concerns. Assume best intentions. Attend to impact. We may not always get it right, but we stay open to learning and repair. One mic. Only one person at a time. Avoid side conversations, but usually sometimes we do this in person. So I added side conversation on the agreement, but on Zoom, feel free to always stay on mute unless you're asking a question towards the very end. And if you have questions, feel free to put them in the chat as the conversation is happening. Respect time. Be mindful of the time so everyone has a chance to share. Community care. Care for yourself. Take a break, drink water, stretch, use the bathroom, do whatever you need to do to support the collective well-being of the group. I'm gonna stop sharing that a bit. And then we'll get into introductions. Oops, that's the wrong. Going back. Here we go. So now what we're going to do is give the panelists a chance to introduce themselves. We have three lovely panelists here today. So this is for each of the panelists, as well as Brian. I'm going to pin you as well. I'm going to chime you in as well. For each of the panelists, anyone can start first, but Please feel free to introduce yourself, your name, the organization you're affiliated with, and how did you come to do this work around heart health? Let me stop sharing.
Audrey, you want me to kick us off?
I think you're
Uh,
muted, Dr. Nanna.
can you guys hear me?
Yep,
Okay. So,
I
good
still can't
evening,
hear you.
everybody. Oh, you can't? Rosie, can you hear me?
I can hear you.
Oh, interesting. I don't know why Audrey can't hear me.
Hmm,
I can't hear Dr. Nanna. Can anyone else? Can you guys hear me?
Yeah,
I can,
I could hear both.
Can you
you
hear
can
me?
hear both.
Hmm.
Me too. That's interesting.
You guys hearing Dr. Nanna as well, or no?
Got
Let
it?
me text him in the chat box. Everyone can hear me but you.
Yeah, it's
Sorry,
a
man.
problem on his end.
Well, I'll get us started.
Yeah.
So, so my name is Michael Nanna. I'm a cardiologist at Yale School of Medicine and working at the Yale New Haven Heart and Vascular Center. Um, my work focuses on improving cardiovascular care for everyone, but specifically for older adults, and particularly those living with heart disease and other chronic conditions. I direct the HeartWise research program, which we have some of our collaborators on the call tonight, and our mission at HeartWise is to help people not only live longer, but to live better with heart disease. Um, as you'll hear from myself and Ajar and others tonight, heart disease remains the leading cause of death in the United States. But beyond that, it's a leading cause of symptoms that affect people's daily life: chest discomfort, shortness of breath, fatigue, reduced ability to stay active. And for many people with heart disease and for many older adults, um, the most important question is not just, will I live longer or how can you help me live longer? But it's also, how will you help me to feel good enough or well enough to do the things that matter most to me? Um, and that's really the focus of the Live Better trial that Rosie mentioned before. So Live Better is a collaboration across 10 sites in the United States, including myself and Ajar at the Brigham. It's a national randomized clinical trial focused specifically on older people with what we call stable ischemic heart disease. And what that means are patients with stable blockages in their heart arteries who are having symptoms like angina or chest discomfort, shortness of breath, symptoms that come from heart artery blockages. These are not people who are having an active heart attack, but these are folks who are having ongoing symptoms that affect their quality of life. And so in Live Better, in this study, we're randomly assigning patients to different commonly used what we call anti-anginal medications. These are FDA approved medicines that doctors already prescribe every day. But what we're trying to understand is, in older people, which medication approach is the most effective for reducing symptoms and improving quality of life? And how do those medicines affect more broadly outcomes that matter to older people, like physical function and well-being, staying out of the hospital? Um, and one of the special things that we're really proud of with this study is that we're looking beyond more traditional endpoints that in the past have been studied in cardiovascular trials, to things that are more patient-centered, like quality of life, independence in daily activities, outcomes that are really critically important to our patients. Um, the other thing I'll mention is just that, there are many populations, including older adults, who have been historically underrepresented in cardiology trials and in scientific trials in general. And these are populations that make up really a huge proportion of the patients that we take care of with heart disease. And so, without research that specifically includes, for example, older people, I think it's really hard for doctors and providers to extrapolate the results of studies that were done in younger people to our older patients. And maybe those studies don't reflect necessarily the needs and priorities of those patients. And so that's just why I would say like participation in clinical research is so, so important. Um, it's how we generate the evidence to take care of folks in your community, and it helps ensure that the treatments that doctors recommend are based on data that reflects, the patients we're actually taking care of, who are those ages and have those health conditions and those goals. And so, programs like this where we have members of our community really engaging with clinical research, I think it contributes not just to your own care, but to the better care for patients in the future. So it's really an altruistic thing to do. And so, I think I'll just close by saying thank you for having me. I think heart health is a partnership between patients, doctors, clinicians, families, and researchers. And so I think, working together and supporting programs like this and also clinical research like Live Better is really crucial to improving the treatments that we deliver for heart disease and helping folks to live more active and meaningful lives. So thank you again, and looking forward to a great conversation.
Yeah, thank you. How about anyone else? Dr. Kochar, I saw you on mute.
Yeah, sure. Yeah, my name's Ajar Kochar. I'm an interventional cardiologist at the Brigham Women's Hospital, and have the privilege of working with Dr. Nanna, who really is the lead for this Live Better endeavor. But maybe I'll take a step back because this is sort of our heart health and sort of talk about heart health in general, and then we'll sort of go from there. So I guess I'd want to take I want to leave you guys with sort of three key messages. The first message is that when we think about heart health, especially as you're getting older, I almost think about the heart kind of like a house. And so a house has plumbing. So heart artery disease, a lot of times when people say heart disease, they mean heart artery disease is a blockage of those heart arteries. Um, You can have problems with the valves. So in particular, as people get older, those valves are kind of like gates or doors. And so you can get something called aortic stenosis or a stiffening of that valve. So that may be another problem. And then like a house, there can be an issue with the electrical system. And so sometimes the electrical system can be problematic, especially as people age. Um, the electrical system may fray and that heart rate may dip very low. So there are sort of two, I would say, big things. If there are sudden symptoms that any of you experience, sudden shortness of breath, sudden chest pain, sudden dizziness or lightheadedness, like you're going to faint, those can be life-threatening causes of heart disease, any one of those issues, or even a pumping issue with the heart. And often, if you can get to the hospital quickly, elite doctors like Dr. Nanna and others can treat that in a very time-efficient way and actually save your heart from permanent damage. So time is of the essence, so that if you wait too long, sometimes permanent damage can happen to the heart that it can't recover. So if you or a loved one has a sudden onset of symptoms, I'd like you to take away from this discussion. Just come to the hospital, come to the emergency room. You may be wrong. Maybe it's nothing. And that sucks, to be honest, right? It sucks to be stuck in the emergency room. Oftentimes there's long waits, but I think it would be far worse to miss a major heart attack that otherwise we could have treated very quickly or efficiently. So that's sort of concept number one, is to think that there is a great time sensitivity. Concept number two is that for a lot of heart disease, there is an ability to prevent it from happening on, or prevent it from getting worse. And there's a lot that is in your control. And there are many things that are not in your control. Like you can't control your age, you can't control your genetics. But I would like you guys to focus on sort of maybe three key concepts that you can control. You can control your exercise. So the American Heart Association recommends 2.5 hours of moderate exercise each week. Moderate exercise means that you can't have a full-on conversation. So if you're having a full-on conversation with a friend or something on the phone, then you're not quite pushing yourself. So if you're pushing yourself and 10's the absolute maximum. It's about a 7 there. So 2.5 hours is a reasonable amount of time. Now, I will say when I was in medical school, there was this thought that you had to do a certain amount of exercise before you derived any benefit. There is no minimum. So even if you can't reach that 2.5 hours, that's okay. Something is better than nothing. And I see a message walking, I think, is great. If you can push yourself while walking, by pushing yourself, I mean pushing either the pace or even on an incline like hills. I think that's helpful. There's this fitness trend now called rucking, where you have a little weight with you that will also make it a little harder, which I think is reasonable as well. Certainly, as we age, as Dr. Nanna was alluding to, there are a lot of physiological or changes to our body. One of the key things is that our muscle mass starts to decline and our muscle strength starts to decline. So I would couple that moderate exercise, whether that's walking, jogging, biking, swimming is great, especially for older adults, with some resistance training as well. And then the third thing that I think is very underplayed is sleep quality. So high quality sleep is very restorative and very important for your heart. So that's really important as well. So I'll get off my high horse and just say I really appreciate everything that Dr. Nanna and his team has done. We at the Brigham and as by extension MGH are a site for Live Better. So if you live close to us and you have heart disease, and you're an older adult, so 65 years or older, you can reach out to us and we would love to include you in this study. We have found that individuals who participate in studies like Live Better actually tend to do better long term because they're just more touch points with the medical system, and you're having different people thinking about you in different ways. So we'd highly encourage you to do that. Even if you don't want to participate in the study, we're certainly here for any questions or concerns that you may have. And I would say for this study in particular, clinical research spans a huge spectrum, right? Dr. Nanna and I are interventional cardiologists, and so sometimes that includes new devices. So I would say the risk of those kind of studies is slightly higher, right? It's something totally new. What Dr. Nanna is really proposing with this Live Better study is studying two sets of medicines that have been used for decades and overall are very safe. And so I think the Live Better trial in particular is one that really is very patient-centered. My wife keeps telling me I talk too much and don't do a good enough job of listening, so I'm going to pause, but I do want to introduce one
Oh,
of my
thank you.
patients, who is Mr. Brian Lahan,
Yeah.
who really sort of is more of a friend at this point. So Mr. Lahan can tell you about his medical history, but he came to me because he had severe heart artery blockages, so that plumbing problem. As an interventional cardiologist, I offered him to treat that with stents. And frankly, I think he would have done really well with that. But Mr. Lahan's a very thoughtful person. He's very erudite. And he said, let me try medications first. And in fact, he's continued to manage himself with medications. And so I guess I'll stop by just saying for heart artery disease, just in case you're wondering, there are three types of medicine or treatments: medication,
We'll probably get into that a little.
stenting, and then bypass surgery. And then we'll give it off to Mr. Lahan. And I apologize for
Yeah.
taking up so much time.
No, that's fine. No, that's fine, Dr. Kochar. I think there's a question actually about that. So you can definitely elaborate a little bit later about all the things that you said that to prevent heart health, exercise, and there's so much more, right? And weightlifting and so forth and on. So there's definitely a question there for you to elaborate a little bit more in the convo. Doctor. Bouba, did you want to introduce yourself? And how, your organization and how did you
Yeah,
even come
yeah,
to do this work on health? I know I already heard your story, but I'm going to ask you a little bit more,
yeah.
to go a little bit more in depth a little later around about your story, but just like briefly around your journey a little bit.
Yeah, no, thank you. Thanks for having me. In my journey, I was mistaken to be a doctor. So I remember at the Brigham, everybody would walk in and be like, "What's your specialty?" I'm like, "No, I'm not a doctor, people." They thought I was joking about that too. So, um, thanks for having me. My name is Bouba Jeme. I'm a heart transplant recipient as of
Beninde.
3.5.
This is the guy.
Heart of Ajar Foundation. So we're based here in Boston.
You're breaking
Can
up.
everybody hear me?
You're breaking up. You want to go back? You're breaking up.
Oh,
I want people to hear that.
yeah, I think I know.
Yeah.
1 minute.
Yep.
Yeah, no, it's okay. I think I know what's going on. Yeah, okay.
Okay.
Is it better now? All right. Sorry
Yeah,
about
better
that.
now.
So basically, I would say my name is Bouba Jeme. I'm the founder of the Heart of Ajar Foundation. We are based here in Boston. So I came to heart health not through medicine, but through my lived experience. When I was 25, I was diagnosed with advanced heart failure. Basically, I think it was level 3 out of level 4 in the jargon. So I spent my early those I think 4 years on medication. So we had it under control, but then it kind of escalated at some point to the point that I needed 24-hour IV. And so I did that for 6 months. Another time, and after that, I had about close to 6 years on a device called the LVAD, which was basically a pump that was put inside my heart to help it pump while I was waiting for the heart transplant. So we waited close to 6 years, and as of October 2022, I got my new heart, and I've been doing well since. So basically, how we got to Heart of a Giant is essentially throughout that journey, multiple countries, multiple, I'll say, continent. I got to see that people like me don't usually get the certain level of care or level attention that was available to everybody else. So when I say people like me, specifically Black people, and also Black communities had like higher prevalence of heart disease in general, but including some of the more prevalent one like hypertension, diabetes, and many others. So that's how the foundation came about. I was just sharing my story, blogging a little bit just to make sure I don't keep emailing everybody asking about my health. So at some point we decided to start with a lot of education. So we started during COVID, 2020. Just I think March was our first webinar. So we started with education, and then we quickly shifted towards doing basically one-on-one conversations through screening and education. So we have partner locations across Boston where we go regularly. In some locations we get invited like a once off. So we have nurses that basically work as community health workers that will work with the participants, and then these participants relate to them. They get to engage them. They get to build trust and continuity. So they become this platform or infrastructure between the visits, between the patient's visit with the provider. So we've been able to monitor and help a number of people. So I think just generally, I think since we've started, we've served about 3,800 people through various programs, but through our screening specifically, we've served about 2,500 people. And like last year, we did 1,300 screening, and then that was about, I would say, close to 800 people that came. Many of those come multiple times. So we've been able to see some improvement up to like 74% in the rate. So this has been some great numbers that we're very proud of. But we've been doing a lot of partnership. Just wanted to echo that some of the words that the doctors mentioned. We've been doing a lot of partnership with community members, but also with physicians, and we are working to formalize those. The other aspect I wanted to just echo, and why I'm very happy to be part of today's panel, is the participation in research and also supporting research. But I think for us, especially people from our community, there's a lot of mistrust. Rightfully so. So we want to, I think, acknowledge that and also build from that. So there needs to be some. We came up with a model of engagement that could allow some community engagement and community involvement in the research, whether it's researchers are motivated by the community or led by the community or by the researchers. There should be that continuous engagement. So we've taken the strategic decision to support that this year. So I'm excited for today, and thanks for having me. Now you're muted. You're muted, Rosie.
Rosie, you're still muted.
Oh, thank you. I'm talking to myself. Brian, do you want to share a little bit about yourself and your experience with Live Better trial and really what brought you there and how did you get there? Oh, you're muted.
Okay. I'm speaking today. I was invited to speak by Dr. Kochar, which I appreciate very much. I'm very flattered and honored to be here. About my experience as a cardiac patient, but I've had experience not just as a patient. A number of years ago, my wife passed away from a sudden and overwhelming heart attack.
Mm.
And we had never paid much attention to heart health. We had never paid much attention to prevention or diet or anything like that, those items that Dr. Kochar mentioned. So several years later, and Bouba, I'm so glad to meet you. I'm a lung transplant patient. I got 2 new lungs. So anyway, I discovered around 2019 that when I went out in the cold weather, my chest just crunched up. And I know there's a medical reason for that about the veins getting smaller in cold weather. But I assumed the problem was my lungs. So when I spoke to my doctor and said, what's happening here? She said, well, we're going to check your heart. And I said, oh, my heart's fine. Don't worry about that. So she sent me for a stress test, which is about the hardest thing I've ever done. And I really thought, when I finished that, I thought, maybe I do have a heart problem because it was very, very difficult for me to do that. And that's when I was assigned to Dr. Kochar, and we've met every few months ever since then. As he mentioned, I started on the first medication he started me on was nitroglycerin. And for those of you who aren't familiar with it, nitroglycerin is just a tiny little tablet you put under your tongue for symptoms of angina or angina. And Dr. Kochar said to me many times, would you consider a stent in that artery? And the stent is something that just kind of expands the artery so that more blood would get through. And he was very honest and said, this won't extend your life by 1 minute, but it may help to relieve symptoms. And I gave it a lot of thought, and I don't have a lot of symptoms. I don't get angina very often, unless I go out in cold weather. And the nitroglycerin tablets were working very well for me. It's very quick relief and very easy to do. I never go out of the house without my bottle of nitroglycerin tablets. And so I decided that, I continue on with the medication because it's working for me just fine. I do have some notes here, excuse me.
Oh, we can get to like more of your story a little later if you like. Yeah.
Well, it's up to you. I'm almost finished.
No, go ahead. Yeah, feel free to finish off. You got it.
But I think, reiterating what Dr. Kochar said, if you do, anybody who does have symptoms really should get them checked out. I had no idea. And nor did my wife. When my wife had her heart attack, she was 50 years old. And never recovered from it.
Mm.
So it's a very serious problem. But I'll tell you what, though, I have changed my lifestyle, and I think that anybody with cardiac problems probably has to change their lifestyle in some regard. And the same thing that Dr. Kochar mentioned. I do exercise daily, and I do more than 150 minutes a week of exercise. But I'm retired. I have time to do it. And I think Dr. Kochar's point of saying, whoever, whatever you do is better than doing nothing. So if you can't do 150 minutes, but I happen to be retired, which is a nice position to be in, and I have the time for that exercise. I also watch my diet very carefully. I have pretty much stopped eating ultra-processed foods and reduced my use of just regular processed foods as much as I can. I do most of my own cooking, so I know what's in the foods I eat, and I buy all my own food myself. So I know what's going into my food, and I think that helps me quite a bit. I do exercise quite a bit, and fortunately, I have the luxury of being able to sleep. So with great exertion, I get symptoms of angina. Just 2 weeks ago, so I was carrying some I live on the 3rd floor of a triple decker in Brighton. And a couple of weeks ago, I was carrying 2 bags of groceries up the stairs. And when I got up, I just had this pain in my chest. I knew it wasn't a heart attack. It wasn't a severe pain. And I've had this pain long enough that I know pretty much what it is. Although I used to always think it was mistaken with indigestion, but that's a different story. So anyway, I took a nitroglycerin tablet, sat down. 5 minutes later, I was good as new. And so I do get symptoms occasionally, but I'm pretty careful about what I eat. I'm pretty careful about my exercise. I rarely get symptoms while doing exercise. And I do the best I can to keep myself going. So, I am older, and I've slowed down in some ways, but I don't think the slowing down, some of it is probably due to the cardiac condition, but most of it I think is just age. And people slow down when they get older. So I thank you very much for inviting me here tonight. And I hope that my comments are helpful to some people.
Yeah, no, thank you for sharing your story. Yeah, we could slow down a little bit and still stay active a little bit, right? Yeah, thank you. Let's move on to the next question. I think, when we talk about the heart, we don't know how the heart works. So this question is for Dr. Nanna and Dr. Kochar, whoever wants to jump in. Can you break down how the heart works in simple terms, and what should the average person understand about their heart?
Yeah, I can jump in and then I'll let Dr. Nanna sort of build off it. Dr. Nanna and I actually trained together at Duke, and I'll say that he's a lot smarter than I am, so you should definitely listen to him. But I think for simple reasons, the heart's actually kind of a simple organ. It's very elegant and it does get complicated, but it's kind of simple. It's a muscle that fills with blood. And I would think about blood in simplistic ways as kind of like trucks carrying oxygen, and it just carries oxygen. It's kind of like the fuel that every cell of your body needs. If the cells of your body don't get oxygen, they die. That's as simple as that. And so the heart's job is to push that blood carrying oxygen to every single part of your body. So the heart sort of relaxes, it allows blood to come in, and then when it has enough, it squeezes and it pushes that blood forward. And that blood goes then through these roads, which are called arteries, and it goes to every part of your body. So how can things end up being a problem? Sort of like I was alluding to earlier, the heart, unlike you and I, it can't go to sleep, right? If the heart goes to sleep, it's game over for us, right? So it needs a constant source of energy. And so there are 3 major heart arteries that feed the heart. And if there is a blockage in any one of those or in multiple one of those, that can then cause you to have pain, chest discomfort, or shortness of breath, or some people describe it as just an uneasiness feeling. So that's sort of how I would, I guess, at a very basic level, say that it has to relax and it has to squeeze. And there can be problems with relaxation, especially as people get older. things get stiffer, right? Your muscles get stiffer, and so it can't relax as well. And so people get what's called heart failure from that. They get short of breath from that. And then if you have had a major heart attack, or disease from other reasons, like an infection that affects the heart, then it may not squeeze normally as well. And so you can develop heart failure from that as well. I'll let Dr. Nanna speak some more to that.
I can't really improve upon that. I have I guess a pretty simplistic way of thinking about the heart as three parallel systems working together. So the pipes, the pump, and the electrical system. So the pipes are your coronary arteries, your heart arteries, the blood vessels that bring oxygen-rich blood to the heart muscle itself. And when you get narrowing of the heart arteries of those pipes with cholesterol plaques, the heart muscle doesn't get enough blood flow or oxygen, and that's when you get chest pressure or angina. And if a pipe closes off completely, you get a heart attack. And so in many patients in Live Better, the issue is this stable blockage of the pipes that cause symptoms that aren't an emergency. The pump is the heart muscle pump. So its job, as Dr. Kochar explained, is to squeeze and relax and to circulate blood throughout your body to your brain and your kidneys and your organs. And if that pump becomes weak or becomes too stiff, it can't move blood effectively. And so that leads to what we call heart failure and can give you symptoms like shortness of breath and swelling in the legs or feeling tired. So even if the pipes are okay, the pump itself can have trouble. And then the electrical system. So the heart, amazingly, by really a miracle of nature, has its own electrical wiring. And these are the signals that tell the heart when to beat and how to keep a steady rhythm to the beating. And if your electrical system misfires, people can get arrhythmias. And those are heart rhythms that are either too fast, too slow, or irregular. And that can manifest as feeling extra beats or palpitations. You can feel dizzy, or you can even faint. And so you really need all three of these systems, the pipes, the pump, and the electrical systems, to work together every second of every day for your heart to function appropriately.
Thank you. I hope everyone found that helpful because I was like, oh yeah, I was all into. I'm like, oh yeah, the heart's so fascinating. Like, so, you have a heart, right? You're alive. You can't survive without a heart, but we don't know how it functions. So that was really like for me. I mean, and I hope for the audience, really clear, enough for me to understand how it works. Yeah, I was thinking, so Dr. Nana, how is research shaping better screening practices and treatment approaches? And what does Live Better trial teaches us about that?
Yeah, so there's two parts to that question. A big part of clinical research in cardiology is how can we streamline and make more efficient the diagnostic processes that we carry out for our patients? Meaning, how should we best test patients and how can we best detect disease as early as possible so that we can deliver effective therapies? And there's lots of different studies that look into how do you do that in the best way. And there are guidelines that guide our care as doctors to sort of help us with screening practices and doing screening at the right time for our patients. And then separately, there are many studies that evaluate the best way to treat patients with either medicines or with invasive therapies like the stents that Dr. Kochar was talking about before. And we're always trying in cardiology to learn more about what's the best medicine or the best practice so that we can help patients to feel better and to live longer. And that's what Live Better is doing. We're trying to determine what is the best medicine for patients who are older, who are living with multiple chronic conditions, to help them feel better and improve their quality of life, because unfortunately, historically, many different patient populations were excluded from clinical research studies, and that includes older adults. And so when you look back at the evidence that supports the treatments we deliver, most of that evidence was generated in younger people. They didn't allow an 80-year-old person into those studies, or a person with frailty, or a person that, was bedbound or in a nursing home into those studies. And so to extrapolate the evidence from studies that were done in mostly young, healthy people sometimes can lead you to the wrong conclusion, and maybe lead to a therapy that isn't the right therapy for that patient. And so that's really why, again, I'll emphasize how important it is to participate in clinical research, so that when you're getting a treatment from your doctor, you feel confident that that treatment's the right treatment for you.
Thank you. Did you want to add anything, Dr. Kochar?
Yeah, I just think the privilege of participating in or being involved with research just allows us to reach out to more patients. And so again, even if you as an individual aren't eligible for the trial, I think that the more touch points you have with the medical system, the more you learn, right? Every time that you are sort of engaged with the sort of broader health system, I think it's oftentimes you're getting a blood pressure that's checked, right? And so if you didn't realize that your blood pressure was high, or maybe even you're on blood pressure medicine, but it's not quite optimized, right? So, for example, something that a lot of people don't know, a lot of people will tell me, a lot of my patients will say, hey, my blood pressure is good. And then we'll look at their blood pressure, and it's actually usually in the 130s, 140s. And so, again, Dr. Nanna has been focusing a lot on our older adults. Well, when Dr. Nanna and I were in medical school, the teaching was it's okay to have a slightly higher blood pressure for if you were older, if you were in 60s or 70s or 80s. But there's newer data, including thousands of patients that were randomized to a lower blood pressure goal and a higher blood pressure goal. And the lower blood pressure goal is 120 or lower. And those patients have fewer heart attacks, fewer strokes, less kidney disease, and less heart failure. Now, there are more side effects because you probably need more medications and higher doses. So everything is a little bit of a trade-off. But I think that there are two major advantages. I think the nice thing about being part of Live Better is that if you as the patient engage in it, even if you don't enroll, there's more touch points with the medical system and more opportunities to optimize your prevention. And then the second thing is that if you are actually part of the study, is that we engage with you multiple times and really help, one, make sure that we're not missing any symptoms that we should be, and two, then optimizing the preventative strategies at each touch point.
So if, say, community member applies to be part of the research, is this research free for the community, for the person that's applying?
Yeah, not only is it free, it is also we also have funding to accommodate transportation and other factors like that. So, for example, if you're coming in from Hyde Park, but transportation is inconvenient, we can pay for an Uber or a cab, or if you're driving in and you prefer to drive, we can pay for parking and so forth. So we can accommodate those kind of inconveniences.
Yeah, I would just add one other thing. Not only is it free, and not only are there funds available to support like convenience around transportation, but actually there's a small honorarium associated with it. So we give gift cards to folks that participate just as a small thank you, and most studies do. I mean, there's a little variability in terms of how much that is. Like for Live Better, it's I think four $25 installments, so $100 total in gift cards for folks that participate, just to thank you for your time. And so that's pretty common in clinical research. Now, obviously, you don't want to pay so much that it's coercive, but I think just a nice thank you for folks for sharing their time.
Thank you so much. I wanted, people to hear that, that it's, if you're interested, apply. And if you qualify, go for it, they're here to support you. And Dr. Kochar did mention blood pressure, and I'm thinking of Bouba because his his foundation does a lot of work around blood pressure, diabetes check, blood sugar. Bouba, this question's for you. What type of screening helped guide you? And what type of screenings are you doing in the community to help through your organization, through your foundation to prevent heart disease, not heart,
Yeah. So
to promote a healthier heart?
no, thank you. So our main screening and it's been blood pressure. So when we call it screening, it's a mix of both. So education and screening. So we usually get people to learn to measure their blood pressure, and we encourage them to do at home. Initially, we used to give away blood pressure machines. But basically we focus on that. But the idea is to engage them enough that they come more often. So you need more than one touch point. So once we're able to establish a baseline, we're able to support them between, with advice, educating, understanding what the particular situation is. But the first thing we do is really to encourage them to consult their providers. So we have many cases where people, where participants haven't visited the provider or don't know how to navigate the system. So we kind of try to reiterate their rights and then maybe better ways to navigate the system. And at the same time, too, there might be some additional support they need, whether it's access to resource, access to other specialty, like even some of the issues might be social, some of the issue might be mental health related or community. So we try to support them, holistically. And the other part is, as we know, and I think Doctor alluded to it, the human body is a system, so everything is interconnected. So the heart is one part, but then it is affected by other part of the body and vice versa. So we started with areas that are non-intrusive, so we try not to poke people in at different areas, but we've been able to do some random glucose testing. Blood sugar, I guess, testing. So we've been able to support people around that, and we try to educate them in different areas where it comes in. I just want to say there's the main issue we've seen is really engaging with the providers, engaging with the system, knowing where to go for help, and also when to go for help. So that's been our observation. So for instance, a lot of people might have questions about the medication. They might start to take a medication, they feel better, and they're like, okay, maybe I can stop now. And some of the ideas we take for granted, or other cases, they might start the medication and don't feel good about it, and just stop, so that they could understand that maybe going back, giving the feedback to the provider, there might be an alternative, there might be a different way. We have other areas where they just, patients just stop going because they're not getting the attention they want. So we have, our care, our coordinators help them go back and find the right, find the right providers. So we had cases where now they feel happy to go back to the providers and they know what to expect, and vice versa, what's expected of them as patients.
Thank you for that. That's Heart of a Giant. We've partnered with them a few times. And their website is in the chat. They have a few events going on next month and the following. So stay connected with them.
Yeah, thank you. I just want to touch base on that. We have we predominantly support areas in Mattapan, Dorchester, Roxbury, but we go as far as East Boston. We've had activities in Brockton, a lot of areas in the Dorchester, in the Boston area. But those are predominant areas, and everything is free. You can just show up to the event. With all our services are free. We just have hubs where we go regularly, including what you mentioned. We were glad to partner with you last summer with 2 new locations. So I see a question from Monica as well. So we have those event sites, so feel free to show up on the date and time. In addition, if there are different locations that you'd like to suggest, we're happy to. We'll add those. Obviously, beginning of the year with the snow and the cold, things are a bit slower, but we do have at least one activity a week, and it start to pick up during the summer. I think summer we end up having multiple locations where we go weekly. So yeah, stay tuned. But in between, feel free to reach out to us. We can have one of our providers connect with you and also find a way to support you. And lastly, I'm always excited when I see her name. We have one of our favorite participant here. I won't say her name, but she's on the call. I just want to say that I see her. And then this is my favorite story because I don't go to the site. I don't do a lot of the work, but every now and then I look at the names and the numbers, and I see this person name is in, Matapan, she's in there, Roxbury, she's in there, Dorchester, she's in there. I'm like, something must be wrong, like the data might be wrong. So it was the same person. I just want to appreciate it. That's my best story, and I just wanted to acknowledge her.
Yeah, no, cool. Yeah. Thank you. Yeah, thank you for sharing, everyone. Yeah. Let's time is ticking. We have about probably like 15 minutes or so. Dr. Nanna, I know you're doing some research around heart health. What's the latest heart health research showing us right now at this given moment?
Nah,
Right
that's a
now.
loaded, that's a
Is it a
loaded
lot?
question.
Too much? Yeah, it's a lot. Can you summarize it?
I think
We don't have much time because I really want to get to the question around what are some prevention screenings and things like that people can do. But if
yeah, I think there's so much
I know.
exciting research going on. I think the things I get asked about a lot in clinic are maybe the things I'll highlight for you now. So I'm always getting asked about the latest and greatest around the GLP-1 receptor agonists, meaning the weight loss medicines, the Wegovy's and the Ozempics and Mounjaro. Um, and so, the data suggests that these medicines are extremely effective for weight loss, and they seem to have pretty compelling heart benefits, especially in patients who have existing heart disease. So, patients with heart failure and patients with coronary artery disease, but even patients who are overweight that don't have heart disease seem to glean heart benefits. So that's a really exciting area of research from the last couple of years and ongoing research, including from our group. Um, another element that I get asked about a lot is cholesterol, whether that's LDL cholesterol or whether that's lipoprotein little a, LP little a, or ApoB. I get asked questions about that a lot in clinic, and I think there are a number of studies that have either been published recently or going to come out in the next couple of years, um, evaluating whether you can lower LP little a and affect heart outcomes. And so there's a lot of excitement in that field, and it really a lot of exciting studies from our group and others that are coming out around that. And then the last thing I'll say that I get asked about a lot is coronary artery calcium. And so lots and lots of patients are getting tested for coronary artery calcium, the presence of coronary artery calcium, and how much of it they have, and what does that mean. And I think maybe some misinformation out there around coronary calcium, and it doesn't. When you have a positive coronary artery calcium score, that does not mean that you have a blockage. It just means that you're at higher risk than someone who doesn't have coronary artery calcium for getting a blockage. And so I think talking with your doctor and really understanding what that test and any screening test means and doesn't mean before you have it, I think is really important.
Thank you for sharing that. That was an interesting one with the GLP because I've been reading a lot about it, but I'm like, what is this? Then I started reading a little bit more about it. That's funny you mentioned it because I started reading
Mhm.
about it last week. I'm like, I never heard of it. But people use it for weight loss medicine and all that stuff. So,
Mhm.
okay.
Yeah, I mean, it's so the interesting. There's so many interesting things to talk about with GLP-1s, but I think one of the most interesting phenomena is usually as a physician, when I'm trying to convince a patient to take a medicine, it's a little bit of a negotiation because patients are concerned about side effects and they don't want to feel bad on the medicine. And GLP-1 receptor agonists have sort of reversed that relationship a little bit because patients are really motivated to lose weight. And so I get asked to prescribe GLP-1s more than any other medicine I've ever encountered because patients are really motivated to lose weight and to feel better. And so And so it's kind of a win-win for us as cardiologists, because these are medicines that I think have real proven cardiovascular benefits, and patients are motivated to take them.
Thank you for that. So this is for all the panelists, if you want to jump in. What are some early prevention screening tests people can request at their doctors? Sometimes you go, you don't even know, what are some things I can request so that way people can actually advocate for themselves at the doctors? I find people find it difficult to do that because they don't know what they're advocating for. They don't have a list of testing written down to say, hey, this is what I need, this is what I need. Dr. Kochar, I don't even know where you at. Dr. Nanna, Bouba, you've been through it.
Yeah, so I think Dr. Kochar had to drop off
Okay.
at 7. I'll kick off. So one of our board members is well, we have a few board members that are doctors. One of them kind of shared a story, and I think your question made me think of her. So I think for me, the place to start is to have this relationship with your provider, like your primary doctor. You need an anchor point. And then what she did, is to have a conversation, like a candid conversation with the doctor about her goals in life. Like, it's not a life planning, but if you want to live healthy, like I think Brian's case is, perfect. You want to live healthy for as long as you can. If you want to make it to 90 years old, or you want to make it to, 70, 60, there will be, I think the test will be based on that. Obviously, there's always something, whatever is happening now that is painful, be addressed. But that's what I would say. I would say to start before any screening. And I'm saying that also because there's a lot of off-the-shelf testing people can do. But I think it's very clear that the roles are separated. Like, you're a patient, there's a provider, you have a caregiver and all of that. So that's what I would suggest to start with. So for me, to answer your question, is start with your provider, start with the goals that you want, and then go from there.
So we have my near 5-year-old joining us. So he's going to help me with my answer. That was a great answer. I just want to compliment you on that. That was very insightful. I would say that from a cardiovascular standpoint, you want to make sure that your cardiologist is keeping track of your cholesterol numbers. So that's one of the easiest modifiable risk factors for heart disease. You want to make sure that you're keeping track of your blood pressure, and that the blood pressure is under control. And then, I mentioned coronary artery calcium screening. I think for folks where there's a question of whether they should be on a cholesterol lowering medicine or not, they're kind of in the borderline. Coronary artery calcium screen can be really, really helpful. Gianni. This is Gianni. Say hi.
Hey, buddy. You're welcome here too. And I think Dr. Kochar, this is like I found a question, and then we'll go open up the floor for questions from the audience. What are some practical things people can do to take care of their hearts now? I know Dr. Kochar said exercise and lifting weights. I recommend yoga. I recommend walking outside. I recommend breath work, but that's some things I suggest, just trying to stay active, but also resting the heart, how that's important to find that balance. But feel free to jump in, Dr. Nanna and Bouba. Anything else you want to add to that?
I think you hit the nail on the head. I think avoiding a sedentary lifestyle is the most important thing you can do for your heart. Stay active, just like you said. Um, there's lots of other things that are important, eating healthy, reducing stress in your life, which is easier said than done, making sure you take your medicines and you're staying on top of screening. But if you had to ask me one thing, I think it's staying active.
I think the doctor has spoken. So I think definitely, I think keeping moving is the main, for me, number one, and everything connects to it. Whether you eat, if you eat well, you want to keep moving. I think to me, it's been one of the best things, because even mental health wise, dealing with stress, exercising helps you deal with all of that. I just shared quickly the recommendation from the American Heart Association, and they keep doing this. It used to be what did they call it? It used to be Life 7 or something. Now they added a sleep. So you have Essential 8. And I think that's a good framework, beautiful pictures, and they're diving into everything. So this is some of the resources we leverage a lot, and we try to, make it as easy to understand as possible. They also have multiple languages. But that's what I would say. I think, anything that would help you move, and then of course sleep and all the other stuff. So nothing can, it's not in isolation. You do your best everywhere. Some areas are better than others. In my case, it was always easy to not, like I never drank or smoke. So it was easy to let those things go. The one thing that was tough is sugar. For some reason, I used to believe juice was, just juice and soda was healthy. So I used to make fun of my friends. So of course, nutritionist tells me no, no sugar, no nothing. So what I did is that I will only eat sweets when I was outside. So like on weekends, I'll go to a friend, maybe take a can of soda. So the whole week I'll try to be good. And then same thing with I had a deal with my mother-in-law, and she will, ship me. We used to live abroad. Will ship me some chocolate from Boston every now and then. So you used to like find a way to motivate yourself. And I think each of us have our weak points. So you try to work on that. I also never like walking, but obviously after the transplant or after the LVAR operation, I couldn't even stand up properly. So I got to embrace walking and go slowly. So I think it's really understanding, but just keep trying, always keep trying. I think that's what I would say. Lastly, also is the community around you, your friends, your family, wherever, finding that circle that will keep you moving. We had cases where, you go to, you be lazy and your friend calls you, but you already have an appointment, or you register for this class, or things like that. But having somebody that will, cheer you on, is always great. I have to pick on Dr. Michael here, but like your kids also having being around is great. 5-year-old. I'm literally in my basement, so I avoid these ones here. I have, so I can relate. They will jump on the screen and stuff. But, keeping up is
Well,
great. So
they're very resourceful, because I had myself shut in a side office in the upstairs, but he found a way.
Funny. It will always find a way. And laughter. Laughter is good. Laughter is good for your heart. Joy. Amidst the chaos, our hearts can get heavy. Like Dr. Nana said, it's a muscle, and stress can weigh on the heart, your muscles, your body, your holistic body. Joy, laughter, pets, kids, family, being around, community, lightens up the heart a little bit. I also think that's healthy for the heart. Thank you. Yeah, this is great. We're gonna open up the floor. We're like right on time. I was a little afraid that we're gonna get through everything. So, there is one question in the chat, but I will read that first, but feel free if someone wants to ask a question, comments, feel free to raise your hand. But this one question in the chat asks, is it are men have, what do they think about Lipton lowering therapies and continuing statins? I don't know what that is. You want to come off mute, especially when, because I don't understand the question.
Hi. Sorry, guys. I had one question from the panelists these days about the lipid-lowering therapies and having everyone on statins, that they say you must lower the lipids because that's the best way to prevent, heart attack and stuff like that. I was wondering, how can I get the intake from the panelists and what do they think about it?
That's a question we get a lot of. I think there's a lot of chatter about statins. If you Google statins, I think there's some misinformation around them. I would say that statins are some of the safest, most effective medications that have ever been invented. And the majority of patients do really well on statins and don't experience side effects. For years, there were a portion of patients, 10%, 20%, whatever it may be, who had muscle symptoms on statins. And again, lots of controversy around that. How much of that is actually from placebo? How much of it is real? Regardless, there are some patients that don't tolerate the medicine. And so, for years, we didn't have great alternative options. And now we do. We have a toolbox full of effective lipid-lowering therapies that we can reach for when statins aren't tolerated or when we don't get the effect that we need from statins. And so while they remain the foundation of lipid-lowering therapy, we now have other options in patients that don't tolerate those medicines.
Did that answer your question?
Yes, thank you so much.
You're welcome. Don't be shy, y'all. Don't be shy. Feel free to put your questions in the chat. If you have any comments too.
Rosie?
Oh, Christine. Hey, Christine.
I just wanted to echo, as I'm in this aging process, like my hashtags are like age strong and fit for life. And I used to love to run, but now I'm a walker. And so I've joined Heart of a Giant's walk that they do annually on the Neponset Trail here. And it really started during COVID because my mother-in-law, who now has end-stage dementia, she was just walking because she couldn't get to the gym like she used to 5 days a week. And the first time I walked with her, I couldn't believe, because I didn't think walking was really going to do anything. But she had taken me some long walk. And then I started getting excited and tracking it using like Strava or maps, like, because everybody's different. Maybe you want to see the number, or maybe you want to see the map. And for me, I want to see the map and the numbers. And I was just like, wow, look at that picture, that diagram. Wow, that was 1.5 miles an hour. Wow, that was 3 miles I did, And so I just want to say, having an accountability partner, don't beat yourself up. Each day is a new day, and starting small. I mean, I started, just walking those 2 miles with her, and then we were up to 6 miles a day at one point a couple of years ago. So that was all.
Thank you for sharing that.
Kudos to you. That's awesome.
Yeah. A little every day, it starts to, be a little, a mile becomes 2, a 2 becomes 3, and then you call a friend, you're like, let's go for 5, and you can just walk. And there's a lot of events in the summer. I know they do run-in events in the community, but also they do walk-in events. When I send a follow-up email, I'll attach all these resources. There's a lot that I already got, but there was a few that was put in the chat. So that way you have the resources you need to take care of your heart.
I just wanted to say I was a participant of the Walk with the Doc during the summer. So that was really nice. And from what I heard today, I just wanted to say, I didn't realize that having high cholesterol is also, it also affects you getting a heart attack and stuff like that. So I'm going to be very careful now taking my statins. So I'm glad I came here and I heard that.
That's great.
Thank you.
I'm really glad to hear that.
Don't tell my doctor though, okay? Because she said, "We won't take your medicine." Okay.
Yeah, it's really important to stay on your meds. Any med that the doctor, prescribes you. I can share the doc with the doc.
Rosie, can I jump in for a minute?
Yeah, feel free.
I just want to, Dr. Kochar invited me to share my experience. And one of my experiences is that, I've been on heart medications for all these years. But once I was diagnosed, I really improved my eating habits, my exercise, and I feel better now than I did, when I first started this. I've lost a little weight. I do 4 yoga classes a week. I walk every day, and I never have any symptoms of heart problems while doing those things. So I think that I've just gotten stronger, and I still have blocked arteries. Those aren't going to go away, but but I think I've got them pretty well under control with diet and exercise. And so it's possible to have this and really feel good too.
Yeah, thank you for sharing that. Yeah. Yeah, people are loving that. Somebody had their hand up. Was it Lily?
Yes, I did.
Oh, go ahead.
Yeah, no, I was just going to say this is really wonderful. I'm enjoying it. I do see a cardiology also for my heart. I don't, but one of the things that I do, and I heard you mention about laughing, and I sometimes when I just want a good laugh, I just put me on a lot of funny videos. And I just sit there and just laugh. And I'm thinking, gosh, what is this old lady sitting here laughing so hard about? But to me, it's funny when I finish laughing, I just feel good. And I find me some funny videos and I just sit there and laugh because I haven't been able to go out as much since the snow is here. So, find me a time to sit back and laugh. So anyway, I just want to share that.
Yeah.
Thank you. I love laughing. I know I'm always kind of like giggling.
Yes.
I need to testify to I strongly believe in that. And this is to be verified, but I heard somewhere that laughing and crying have the same effect on your body. I don't know, but I just believed it. And I literally I'll spend a lot of time on watching comedy, and so especially in those days I couldn't move much. And I still do. I think is the biggest thing, and having people around you. Yeah, the America's Funniest Videos. We have a ritual now with our kids when you don't want to watch TV, you just put fail at me, which I think is wrong because you're laughing at people's pain, but it's it definitely makes a difference. So yeah, I just want to echo that too. Beautiful.
Yes, thank you.
I think there's some
Hi,
one or two. Go for it. Sorry, go for it.
Oh, sorry. I just wanted to interject. There is something called laughing yoga.
Yeah, I know. Yeah.
So, it really helps just sitting there laughing like if you're crazy, but it's healthy for you.
Sure is. I know. I
Love
did a
it.
laughing yoga class once or twice. It was like so funny, of course, but I felt so much joy and my heart felt lighter. I just felt much happier. And you relieve stress as well, tension when you're laughing. So that's what I've noticed. And crying as well, because sometimes your chest gets tight and you might be stressed or you're holding on. I really do believe that the body keeps the score, like our experiences. And sometimes you just need a good cry. I'm a crier. I'm a crier and I'm a laugher. I always feel so much relief when I do that. And sometimes it's not just crying because you're sad. Sometimes you're crying because you're full of joy too, like, all at the same time. So there was a question in the chat. I'm talking too much. There's also,
there was some good questions. One was about
them out if you don't mind, because I can't find it.
I think it's
Find
there's two
one.
questions from Zafir. Well, the first one was about okay, describe me a little bit about staying active. And is it just walking or enrolling at a gym? And I think the second one was also more compelling. They were asking about our thought about taboos that are associated with medicine, or do we consider do we consider taking it or lifestyle modification? So I thought that was also a good question that I love to hear doctors speak on it, and also we can share some of our notes.
Yeah, I'll just briefly, the first question, the American Heart Association recommends 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous exercise per week. And so really you can titrate to your own comfort level. If you're more comfortable with, brisk walking or water aerobics or, dancing or gardening, that's more moderate activity. But if you're more into the vigorous activity of jogging or swimming laps, then you probably don't need to do as much of the time to meet those requirements. And certainly some folks want to do more, and I tend to encourage that as well. I think the question about taboos about medicines and questions around like do I really need to take this medicine, or can I achieve the same results with just lifestyle modifications? We get asked that a lot. I see medicines and lifestyle modifications as complementary. And so you don't need to choose one or the other. I think there are situations where you can get where you need to go with lifestyle modification alone. But there are other situations where medicines are required, and that's okay. That's not a defeat. That's a great thing that we live in an era where we have safe and effective medicines that can help you live longer and feel better. And so I really think you got to take a holistic approach and attack disease from every angle.
Yeah, I want to add to that from our side. I think, and a doctor, you alluded to the stigma of taking medicine. I think early days, for me, it was easier. I grew up with my grandparents and many, taking medicine, and it's probably kept them going. But I think I want to probably start by saying that the taboo around medicine is, can be understood, right? There's many sources for me, like whether it's history. Some people have been avoiding overprescribing, side effects, and all of that. They destroy. So it's some. I think some people comes from it from a point of fear. And like you said, in some cases, that's enough, right? You can do the lifestyle changes to really achieve a certain level. But past that, there are some cases where you have no choice. I get that question for myself, and sometimes with some of our participants, they just don't want to take medicine, and literally the poor nurse will spend like 30 minutes trying to convince them or just reason with them, and they don't change. So obviously, in some cases, with lifestyle change, they do get better. But obviously, but at the same time, we are, our body is different, the environment is different. At some point, some things will kick in, and medicine is almost all you need. And also, particularly in my case, my condition was congenital, and at the same time, we didn't know the origin, but recently we figured out the gene that is causing it, or the gene modification that caused it has been discovered last year. So we know what's causing it. In my case, lifestyle alone, could allow me to maintain, but definitely could allow me to have a quality of life. And at some point, obviously, to the point that you need a new organ. So sometimes you don't have a choice. Sometimes it's not enough. But I think, like complementary aspect it's what's needed to have in mind. And as I go back to earlier, what's the goal you're trying to achieve? Do you really want to just, you know, barely make it? Do you want a medication to help you? But these are issues that I think that are very well discussed now, and hopefully it will be better. But coming to the question for me to ask yourself, especially when there's a lot of information coming to it, it's like, what's the risk if you don't take it? So to me, that's kind of will be the main question.
Thank you for that. What's the risk if you don't take it? And you could sit with that.
We have one more question in the chat,
Oh, yeah.
Rosie. So Laura asked, how can we make sure people living with heart disease get support for their symptoms, stress, and daily life, not just for their heart?
Yeah, I mean that's a great question, and it's a challenge, I think, for cardiologists. I try to take a more holistic approach to patients, and think beyond just the heart. I think one topic that came up a couple of times tonight is not just heart health but brain health, um, and so what's really remarkable is when we're in the silo of cardiology, we're always thinking about, how are the interventions that we're delivering going to make someone's heart healthier? But the reality is that many of the interventions that we deliver for the heart also have an impact on other organ systems and especially the brain. And so what we've tried to do is move as a profession more towards that holistic approach where we're thinking about, okay, we're prescribing this medicine and we're hoping that it prevents a heart attack. But what about its effect on the person's function, or how strong they feel, or is it going to make them fatigued, or is it going to affect their mood or their sleep? And that's really, really important. But I do wish sometimes that we had more comprehensive resources to be able to help patients who have mental health concerns or have stress or are looking for resources to help them with exercise or diet, etc.
Thank you for
Yeah.
that.
Yeah, I sometimes feel for the doctors, and that's because I think traditionally or over time, I mean, slowly over time, the focus has been on the doctors or the health system really looking after people. I think it's um, understanding that there's limited capacity, but also, especially since COVID, there's some saturation. So I think integrating it and a number of elements will help. That's why Heart of a Journey has really been focusing on our model right now. It's really we need some community-based support. Like there needs to be I would say like across the board, like community-based support. We try to play a role of facilitating, but I think having that integrated, having that will fill in a lot of gaps. So whether we want to really integrate mental health support, we can do that through those community organizations or community, systems. Really, including caregivers, I think is very important in the care system, whether they're advocating or just really helping the support system. In my case, one of the criteria to have a heart transplant, and I think Brian can relate to it, is to have a support system. Like because if I didn't have a support system, all that work would have been, almost in vain. I think addressing the social determinant of health, that's something that people hear a lot, but essentially the social driver, whether it's food access, transportation, medication, all those factors need to come, probably be in there. And I think lastly is really, one thing providers can do is regularly keep asking this question of measuring the quality of life and keep asking that question around that. And I would say lastly, I said that earlier, but there needs to be a lot of innovation. We need to really find ways that will be very and very helpful. And also like this research mode, for instance, research like this, like once the outcomes are out, they need to be disseminated further because I think one discussion I have with researchers is that they'll get a lot of the research completed or done, and then they don't move to implementation or dissemination. So I think having finding a way to support that, and we try to use our voice, but I think everybody getting involved will help with that. Those will be very important. There's a lot of good work being done, but it's not spread enough. But also, I think everybody has a limited capacity, but together, obviously, it could be more access could be spread more.
I agree. And that's why we're here to help disseminate this information. We got to start somewhere. So thank you so much to all the panelists for sharing your wisdom, your insight, your story, and taking time out to be here with us in community. And thank you, every single person on this Zoom call for joining us today. Let me just pause. I just want to